Hello, good afternoon. I'm Kirsten Gagnaire, and I'm so happy to be with you today to talk to you about MAMA. MAMA provides age and stage-based vital health information to new and expectant mothers across the developing world directly into their mobile phones. We're a public-private partnership that was launched 4 years ago by USAID, Johnson & Johnson, the United Nations Foundation, and Baby Center. And in this time, we've been able to catalyze a management team and advisory board made up of global experts, the best of the best across the mHealth ecosystem. But today, I'm here to talk to you about MAMA 2.0. Lots of cute babies we have, yes. MAMA was created to respond to a set of staggering, converging global statistics. Every day across the world, 800 women die due to pregnancy and childbirth-related causes. In addition, 12,000 infants die every day. Most of these deaths are preventable, and most occur in the developing world. On the other hand, over 1 billion women in low to middle income countries have access to mobile phones. So this is Tumi. Tumi is an HIV-positive mother living in South Africa. In the early weeks of her pregnancy, she signed up to receive the MAMA messages. She began to receive 2 to 3 messages a week that were timed for right where she was in her pregnancy and the age of her small child. These messages were in her local language and her local cultural context, and in a friendly and encouraging manner gave her a variety of information around nutrition, the need for 4 antenatal checks, why she needed to have a skilled attendant at her birth, the importance of adhering to her antiretroviral medications, and the need to exclusively breastfeed her baby for the first 6 months. And in just 4 years, MAMA has been providing this information to over 3 million families across South Africa, Nigeria, Bangladesh, and India. And most importantly, we know that it works. In Bangladesh, for example, the mothers who receive the MAMA messages are 30% times more likely to engage in critical life-saving behaviors than the national baseline averages. And we've been listening to our large global network of implementing partners, funders, and ministries of health, and we've come to know that we can and we must do more. So MAMA 2.0 positions MAMA as the glue that will bond fragmented health information systems together. While Tumi's condition is just one example of how this can work, there are countless applications for this model. For Tumi, MAMA 2.0 would mean not only would she receive a message telling her that her antiretroviral medication is the only way she can prevent transferring HIV to her baby, she would also receive a message asking her whether or not she had taken her medication. If she responds yes, she would receive encouragement. If she responds no or doesn't reply at all, her healthcare worker would be alerted and would be able to reach out to her to ensure that she takes her medication. That information would then be entered into her electronic health record. Finally, her pregnancy and her HIV status would be recorded in the government's pregnancy registry system. The government would then be able to look at trends, like the fact that in the area where Tumi lives, women are 15% less likely to adhere to their antiretrovirals. They would then be able to catalyze campaigns, increase the messages encouraging women to take their antiretrovirals, and funders would know that more resources are required. And MAMA has been widely recognized as the only organization in the world who is uniquely positioned to do this game-changing work. So MAMA 2.0 allows us to reach 40 million women in 20 countries across the next 10 years. We'll be building on our lessons learned and achieving economies of scale, which will equal serving more women and with more services and taking our cost per woman down from $5 to just $1 per woman over time. We'll do this by creating a portfolio of early, mid, and sustaining stage countries with a model that program costs reduce as programs mature. Building on recent successes of integrating our program into the Department of Health in South Africa, our long-term goal will be to get as many of these as possible integrated into the host country governments. So today, Mama and Tumi are at a critical transition moment. I am seeking $1.5 million in grants, which will enable us to enact 4 sets of critical activities essential for setting the stage for scale. First, we will catalyze our deep pipeline and many long-standing relationships with bilateral government funders and large philanthropic foundations to obtain the first $35 million required for 3 years of implementation. Next, we'll complete Mama in a Box. We won't actually put any mamas in a box, but we will have a franchise model that is required for efficient and effective scale. We'll secure partnerships for the implementing technology and content partners and the ministries of health that are required across all the countries where we'll be working. And we'll augment our current staff and team to ensure that we have all the skill sets and talents required to execute on this bold model. So again, $1.5 million is a direct path to helping us serve more women in more countries with more services. For Mama, this $1.5 million is the most important money that we will ever receive. And we believe that this is the most highly leveraged gift that you will ever give. I look forward to talking to you.